Hi guys, welcome to episode 29 of Healthcare KX. Sorry, I'm eating ice. Alright, so I talk about iterative innovation in healthcare. That was introduced by my Harvard professor. Now, this is my turn, my rebuttal to the word iterative innovation used in healthcare settings. Alright, let's go. Iterative innovation in healthcare industry should not be considered as an improvement for effective digital innovation in healthcare. They are distinctly separate. Also, iterative innovation does not equate to digital innovation. These two, obviously, again, should be considered as distinctly separate from each other. And now I will explain why iterative innovation in healthcare is not a mean to an end. Digital transformation in healthcare are continuously transforming and in a rapid rate. Iterative processes, or what we call iterative innovation, for the sake of this personal comment, rebuttal to the use of the word iterative innovation, which for me strictly means successful digital transformation in the end. But it's still the wrong word, I find, because I'm going to explain in project management term right now. So, in project management, the process of iteration is under Agile practice. The most important concept of Agile is iterative management. This is often and mostly applied and used in software development, game development, as well as with other technological platform improvements that need to be made. Let's stay with innovation in mind as our goal still. Due to the Agile practice, management of software development projects has improved in the recent years and much faster. And thanks to Agile again, software development in recent years can be managed with more effectiveness and easier, especially reducing the time to bring the product to the market or to implement, the internal software upgrades due to the effective management, again, of Agile practice. What I said before previously, Agile practice is essentially iterative process, allowing subsequent versions and updates to be made available to the user. But iterative means going in circles, agree or disagree, whatever, such as an infograph that depicts iteration. Even though the method not only wastes healthcare professionals' time, it's also a bad distraction that uses up physicians' bandwidth, and are ineffective uses of healthcare resources. However, there are healthcare professionals that still acknowledge the fact that the iterative process works well in healthcare due to its steady state of continuous improvement and compatibility with evidence-based medicine. Instead of one massive disruption, change can be implemented in a controlled and tested manner. And that is why I wrote these articles, to distinguish between this, what they call just now, massive disruption, as opposed to what we call in project management, progressive elaboration. So now think about this. Let's use mental health as an example. How would you use iterative innovation in mental health care? That is the main reason that leads to misdiagnosis, overdiagnosis, underdiagnosis, and just outright wrong diagnosis. And that's the reason, because the new medicines are discovered, symptoms are discovered, academic journals are constantly putting out research papers, adding more and more evidence-based information, offering healthcare professionals easier ways to manage their patients' health, but it works differently. It actually has a negative impact. And it's just, I personally, if you think about it, that's why in last episode I say think about these words, these terms. It's because if you look at autism spectrum or ADHD or whatever, like, seriously, if you have iterative, not even iterative or progressive, oh my God, they're totally different. Anyways, I would explain in the next episode. Thank you.